some money, the federal government puts in money, and that's how we get the kids the health care they need. So we put extra taxes on tobacco, which is kind of a double win in a way, because the more we can discourage tobacco usage, the better it will be for health care. So we were able to pass something with a huge vote, a bipartisan vote, to cover more children, as many as we hoped, between 4 and 5 million more, and then the president vetoed it. Now, when we go back, Doctor, what we're going to try to do is see if there's any deal we can work out with the president to get those additional children covered. That's what we're trying to accomplish right now. We have a very big majority. We have a veto-proof majority in the Senate, more than 2/3, but we don't have quite that many in the House of Representatives. At the end of the day, we've got to continue S-chip, so we're going to have to make some kind of deal. But it just shows you the misplaced priorities. We have a president who cares more about no-bid contracts for Halliburton than health care for children, and I think that's disgraceful. So we're going to get as much as we can while he's still president, and then when I'm president, we're going to cover every child and every adult and get universal health care. Yes? Here it comes. Oops.
Thank you so much, Senator Clinton, and thank you so much for releasing a comprehensive plan to fight HIV and AIDS, both here in Iowa and throughout the world, and just in time for World AIDS Day on Saturday. As you probably know, and I just learned about when I was in Washington, D.C. for the Robert Wood Johnson Community Health Leadership Awards, there's a crisis here in the United States, actually in Puerto Rico. People living with AIDS aren't getting treatment and are actually dying if they can't get out of Puerto Rico because of government corruption. The government there is simply not spending the money that they're given to provide health care to the people in Puerto Rico. As president, will you ensure that local governments are subject to oversight and that federal funds to fight AIDS are spent to actually save lives?
Yes, absolutely. Thank you for your concern. Well, I think you've summed it up very well. I'm fanatical about making sure any dollar that we spend is spent appropriately. That's why what's going on with the cronyism and the no-bid contracts and all the corruption and the incompetence in the Bush administration drives me nuts. Now, every government has problems. We know that. We're human beings, and there'll be difficulties. But you need to set up systems of accountability to hold governments accountable. And especially when money goes from the federal government to state government to local government, a lot of it gets siphoned off and unnecessary administrative costs and doesn't get put to the use it should. And I've been fighting on HIV/AIDS for many years to try to increase the amount of money that the federal government spent. So it really appalls me to hear what you're telling me about the misuse or the failure to use, and I'm going to look into that. But we've been frozen on the amount of money we could spend on HIV/AIDS because the Bush administration would not add to the money. And what they wanted to do was take money away from some places to give it to other places, which would have not been fair, because what we need to do is increase the amount of money. And I intend to do that. And as you saw with my comprehensive HIV/AIDS policy, I will tackle this problem from all angles, and I will look into what you're telling me about immediately. There's so many hands. Yeah, yes, back there, yes. Yes.
Good afternoon, Hillary. My name is John Olson, and I'm from here in Ankeny, and my 8-year-old son has an autism spectrum disorder. We've talked briefly about autism on previous occasions. I wanted to first thank you so much for being the first candidate to introduce an autism plan, which you did this past Saturday. I have 2 questions about your plan. My first question is that you plan to fully implement the Combating Autism Act, which was written by one of your fellow candidates, Senator Chris Dodd. Of course, the Combating Autism Act will be implemented once the appropriations are approved, likely in the near future, at the cost of $170 million a year for 5 years. Your plan calls for $700 million to be spent annually. Of the additional $530 million to be spent to address the autism epidemic, in your opinion, where would this additional funding be most in the here and now? And secondly, how does your plan expand upon the Combating Autism Act?
Well, thanks for that. And I remember I talked with you a couple of months ago about autism, and I told you then that it's something that I care very much about, and I appreciate your following this issue. How many of you know somebody with autism or no? Wow. Wow. Well, 1 out of every 150 kids are now being diagnosed, and it's 4 times more prevalent among boys than girls. So in the last 10, 15 years, we've gone from 1 in 10,000 to 1 in 150. So I'm going to put more money into research and a much faster track, because I believe that something is happening here that we don't understand. And it's a combination of genetic susceptibility and environmental influence, and we have got to figure this out. Number two, I have my own bill, the Promise Act, to increase services for people with autism, both the families when the child is young and then individuals living with autism as they grow into adulthood. And we need centers of excellence, because we still have far too many physicians who just aren't experienced with diagnosing autism. We have the autism spectrum disorders. It goes from relatively mild to very profound and serious. And a lot of physicians don't see enough cases, haven't been taught about it in medical school. We don't have enough continuing education courses, which is why I'm thrilled the American Academy of Pediatrics is going to make this a requirement to continue to try to reach out and educate physicians and nurses and others to recognize it so we can begin treatment early. And I'm going to do more to help not only the families deal with this. My universal health care program will cover the health care costs, so we will finally have health insurance reimbursement for the treatments that we know work. But we need to have a lot of research into what works best in terms of treatment. Not only what causes it, but how best to take care of it. What are the best treatments early to try to ameliorate the behavioral impacts if possible. And then we have to have more services for adults with autism. And I was so pleased to have Sally Peterson, the former Lieutenant Governor, with me in Sioux City to make that announcement, because her son, Ronald, is autistic, and he was diagnosed at 2. He's now 24. So she's very focused on what we do when people with autism get to be adults. So all of that is going to be a very big priority of my presidency. Yes, right there.
I'm concerned about having freedom and the ability to get the health care that I think I need or want. I don't think that the current, the physicians in Iowa in particular, because we only have MDs and DOs, we don't have naturopathic physicians. Would you be able to do anything to promote more different kinds of healthcare physicians?
Well, what I think I can do, because part of my healthcare plan, there's 3 parts of my healthcare plan. How to get costs down. As I said, I think I can save $120 billion a year. How to improve quality and then cover everybody. And I think you have to do all 3. And what I have proposed is a best practices institute. We need to do more evidence-based research into different kinds of treatment. Finally, there have been breakthroughs on acupuncture. Acupuncture works very well for certain conditions. Well, it used to be nobody would pay for that. Nobody would reimburse it. Nutritional counseling, dietary changes, stress reduction, there is now very compelling evidence that it can help to reverse and halt deteriorating heart disease, that it can even help with cancer. Not everybody, but there are some kinds of interventions that can be helpful. We need to be paying for that. I started in '93 and '94 to try to persuade Medicare to pay for nutritional dietary counseling and stress reduction for people with heart disease. This year, they finally agreed to do it because they wanted to wait and see the evidence, and now the evidence has persuaded them. So we need to accelerate the collection of evidence, because we have the best, in my view, we have the best doctors,